the symptom. You're focused on finding the source of the problem and actually addressing that.
Go figure.
And that's the foundation of functional medicine. Yes, sir.
Yeah.
You are speaking my language.
So simple.
Well, it is. And the problem with medicine, Western medicine in general, is the diagnosis is the most important because that's what you get paid on.
Yeah.
You know, my clinic is cash. We don't charge a fortune.
You know, the reality is that when I work for the insurance company, because your insurance company is paying me, I'm not working for you. I'm working to get paid by the insurance company. That's the deal that you make when you take your insurance, and it's not necessarily a bad deal because we're hoping that people are honest and forward and have your best interest at heart in the medical field, and that is to an extent true, but not necessarily 100% true. If you're coming in to see me and I'm taking insurance, I'm doing the things necessary to get paid while doing the best I can with what I got with you, and sometimes that means you're being treated by 2 or 3 along with 2 or 3 other patients. Maybe that means that you're not getting the best modality for your problem. And a good example of that is a lot of times you might be getting one-on-one therapy, but you're not getting necessarily manual therapy coupled with exercise. You're just getting the exercise. And if that's the case, you're not going to get the best of the best type of treatment. And the same thing is true in the medical side. They are treating the symptoms and not the root problem. And he says that's the foundation of functional medicine. Sure, I don't care what we call it. The reality is that should be regular medicine. That should be regular physical therapy. Should be addressing why you have pain to begin with. And in his case, symptoms, whatever the symptoms are. If you have diabetes, maybe the main reason why you have diabetes is because you're out of shape and overweight. Okay, well, we have to address that, right? It's not just taking a pill. Now, at the same time, not everyone wants to do that, and maybe the pill is your answer. That's fine. There's no judgment on my part. I feel great. You know, it doesn't matter to me what you believe your the solution is for you. But let's not kid ourselves that we're masking things with medications a lot of times, right? You know, we're masking the real problem. The real problem, you know, in a lot of ways is, you know, your joints out of alignment, joints not moving or whatever, and you take your pain medication. You're not fixing your problem. You get your injections. Injections reduce inflammation. Well, the inflammation came from somewhere. Where is it coming from? Well, it's coming from joint dysfunction. Where did the joint dysfunction come from? Well, bad posture or bad movement mechanics or weak muscles that you need to get stronger because you're sedentary. There's lots of root reasons why you're having these problems. And if a pain pill is better for you, go for it. Take your pain pill. If a diabetic medication is better for you, then take your medication. That's fine. But don't kid yourself that there's not a root problem somewhere that you need to address if you really want to take your health seriously. That's you know, blunt but true.